Morning everybody. Today we'll be discussing technique of MR elastography. In the previous video we have discussed the principle, that is this MR elastography is used to characterize the biomechanical properties of the tissue such as stiffness. Here what happens, we have a tissue, right? The mechanical shear wave is applied to it. This repulsive acoustic force causes small displacement in the tissue. This displacement which occurs in the horizontal plane are called shear waves. Okay. If these shear waves are applied continuously, the propagation speed is reflected in the wavelength. Propagation speed of these waves depends on the medium. Like what? As the stiffness of the tissue increases, the wavelength becomes longer. Waves travel faster in hard tissues. Remember this. As the stiffness of the tissue increases, the wavelength becomes longer and the waves travel faster in hard tissues. The biologic property on which the measurement is based is the difference in the wavelengths of shear waves propagated through the tissues depending on the stiffness of the tissue. This is the basic principle. The biologic property on which the measurement is based is a difference in the wavelengths of the shear waves propagated through the tissue depending on the stiffness of the tissue. According to them, the waves travel faster in harder tissues. So the wavelength becomes longer as the stiffness increases. So normally what happens, what are the parts of this MR elastography? We have an active drive, we have a passive drive. So this active drive, this is a wave generator. It is placed outside the MR examination, shielding away from the imaging magnet. These mechanical waves are produced by this wave generator. That is the active drive. What happens is, it produces a continuous low frequency 60 Hz vibration. 60 Hz waves frequently are used to provide adequate wave conduction in the tissues. So this one, it does not compromise the patient comfort. So one is active drive, which is present outside the MRI room. From there we get the mechanical waves which are 60 Hz. These mechanical waves, vibrational energy or pressure waves, they are sent to a passive drive. This passive drive is kept on the patient, sent to the passive drive through flexible plastic connecting tube. So passive drive is placed on the external abdominal wall and is positioned across to the lower chest or on the right lobe of the liver, secured with a soft elastic band to maintain appropriate contact with the right upper quadrant or rib cage. Then passive drive. From this passive drive, the wave they transmits the acoustic pressure to the abdominal wall and to the liver in the form of shear waves. So we have an wave generator, that is active drive. Through a plastic connecting tube, these waves pass to the passive drive. From the passive drive to the abdominal wall, they transmit the acoustic pressure. The propagating shear waves through the liver are imaged with modified phase contrast GRE sequence, which incorporates cyclic motion encoding gradients sensitive to plane motion. This is the MRI sequence which we use. This is the propagating shear waves passed to the liver or imaged with modified phase contrast GRE sequence, which incorporates cyclic motion encoding gradient sensitive to through plane motion. So the driver system is synchronized to this gradient by means of a trigger in the MRI scanner. This is the technique. Thank you.